Hi, it's Mark Leggott from Research Data Canada. If you're just logging in, we're going to start the webinar in just a minute or two. Okay, I think we're probably ready. Still some people joining, but I think we'll go ahead and get started. There's some administrative stuff at the start. So again, my name is Mark Leggott. I'm the Executive Director for Research Data Canada, and you've logged in for our webinar for today, which is the Research Data Alliance's COVID-19 Data Sharing Recommendations and Guidelines. And I have a co-presenter that I'm going to introduce shortly. Before I do that, I did want to recognize that the person who's working with me on a lot of these webinars is Robin Nicholson, who's RDC intern. And Robin's been doing a great job of organizing the webinars, so you'll probably hear her name when we ask for the slides to be advanced. So I'd like to thank Robin for getting things ready. We do record the full webinar. There's Robin. Thanks, Robin. We do record the full webinar, which includes the video, the audio, of course, and the presenter notes will be available as a separately downloadable slide deck. Those are typically available within a couple of days of the webinar, the live webinar. And anybody who's registered for the webinar will get an email with a link. And we'll also send it out through RDC's channels as well. I would encourage you, if you do have questions, type them in as they occur to you. We will queue the questions up until the Q&A time at the end. But we will respond to the questions in the order that they're received. So if you can type them into the Q&A using the Q&A button at the bottom rather than chat, that helps us keep track and make sure that we're responding to people's questions in the order that they're entered. So again, we will reserve time at the end. And please feel free to go to the RDC webinar page. We do have a number of webinars planned between now and December, including a 5-part series on data ownership, which we're just getting queued up now. We're also doing a joint webinar with colleagues following on from the trust webinar that we did with our colleagues that authored the trust webinar a few weeks ago. So we're going to be doing a Canadian variation of that with our colleagues from Portage. And then we're working with other Canadian colleagues on a webinar series on persistent IDs, also coming up between now and, or between September and December. So a number of webinar opportunities coming up. But as to today's webinar, I'm going to, if you want to go ahead to the next slide, Robin, I probably have covered. Clearly we're going to focus on the RDA guidelines, recommendations and guidelines that were released at the end of June. So we're going to talk about why the working group came together and why the outputs are important. We're going to do an overview of the recommendations and guidelines. It's a fairly hefty document, so Natalie will provide an overview of that, what we learned from the collaborative process, and we'll see an example from one of the subgroups or overarching groups on Indigenous data, and we'll also talk a bit about some of the additional outputs that are coming. Next slide, I think, is references that Q&A button. So as I said, please use the Q&A. Everybody, all the attendees' audio is turned off. So you can't ask audio questions. It also means that you don't show up in the audio recording. Again, we ask you to use that Q&A button so that we can queue the questions properly. So I'm going to introduce Natalie Harrower, who's going to give you an overview of the recommendations and guidelines. Natalie is the director of the Digital Repository of Ireland, which is based in Dublin. And the DRI is the National Certified Trusted Digital Repository, or TDR, as well as a research center for best practices in digital archiving, digital preservation, fair research data management, and digital cultural heritage. Natalie is a co-chair of the RDA COVID-19 working group, and she was the lead on the editorial team, and also co-authored the foundational recommendations that appear at the beginning of the document. And Natalie, for those that know Natalie, know that she's involved in a lot of groups, including those from the European Commission, the European Open Science Cloud, the OECD, and ALIA, or the Federation of All European Academies. And her focus is on the data aspects of open science. So Natalie, well, I should say, I guess I can say this, Natalie's also Canadian, so it's almost like you're back in Canada, Natalie. So I'm going to pass it over to you.
Thank you so much, Mark and Robin, for inviting me to be part of this. I'm really happy to. It's always nice to connect to what's happening in Canada, and I get to stay abreast of that a bit with just being in touch with Mark a lot and learning what's happening on the research data front. So it's my pleasure to actually be here. It's a relatively warm day in Dublin, just after 6 p.m. So good afternoon, earlier in the day to you there in Canada, possibly in different time zones as well. Okay, so let's get started. Just to give you a bit of a background to what happened with this group. You may know of the Research Data Alliance already. I'm assuming that a lot of you do, but basically it's a group, global group, that is dedicated to trying to reduce the barriers to data sharing, both at a technological and at a social level. So back in March, when the pandemic was really starting to hit Europe, really, the European Commission asked the Research Data Alliance if they could put together a group to actually try to author some guidelines around data sharing. How can we kind of facilitate this, make it work better, improve data sharing during this pandemic, because it's become quite crucial to do so. So the answer was yes. And the working group was set up within weeks, and it had quite, it still exists, but most of the main part of our output is done at this point. So it was set up with quite an intense structure, 4 different research areas with groups that were working on those areas, and we'll go into that shortly. 4 themes that kind of cut across those different research areas that are relevant to all of them and more broadly. And each of these groups had moderators to try to organize and direct what really was and has been a collective kind of creation. So it was structured through a series of teams. There are a group of co-chairs. Mark is the super chair, which is both his title and an indication of what we think of him, super chair. I was the chair of the editorial team, and then there were other chairs for different groups, moderators for each of them, and also a visualization team and a group working on Zotero. So quite a lot of different activities happening, different kinds of group structures to try to move those along. Because originally we had about 600 people sign up to be involved. Mark will tell you more detail about that later. So it was a relatively large group to be coordinating around a very specific goal. So from April through to the end of June, we had continual sprints, 6 different releases, draft releases of the document with contributions across all of the groups came out over that period, and there were open consultations following each of those releases, webinars every week to update both the group members, because there were that many, and anyone else who was interested in the work that was happening. So in the end, the document's 143 pages long. So part of the reason for this kind of webinar is to give you the overview. There is a 4-page executive summary, but we'll go into a little bit more detail today. And there's an infographic, which you'll see momentarily. So overall, this process was exhausting, but really exhilarating at the same time, because I think you know, a lot of us in different communities really want to play some kind of role in moving this pandemic forward or helping out in some kind of way. So it was really great to be able to do that from a data sharing perspective. Next slide, please, Robin. So on to an overview of the guidelines. I'll take you through them now. Next slide. Thanks. Okay, so why did this come together? What really are the challenges that were being faced, and why did the Commission ask us to do this work? The really key thing is that there's a critical need for rapid data sharing during the pandemic. Data sharing is important. If you're watching this webinar and you know Research Data Canada, then you're aware and you're probably already convinced of the importance of sharing research data. But under the pressure of the pandemic, which was moving at such a fast pace and still is, the pressure to share data quickly increased as well. And there's been a rapid, massive research response across all different kinds of areas. But what that brings with it, if you look at different domains in different countries, is very diverse outputs. And this challenges the interoperability of data. So it's not just sharing the data, but also being able to use that data and build on it, again, under these time pressures. So really what was being faced and what is still being faced, I keep talking like this is over and it's all very clear it's not, is that there's a trade-off between the timeliness of sharing, but also the precision, and how do we try to find that balance? And that's an ongoing question. So that's one of the main challenges. The other very significant one is, if we're trying to do this rapid data sharing, there really is a lack of harmonized universal standards and context for this kind of sharing. In some cases, archaic information systems that kind of hinder the rapid response and sharing of data, and really no universally adopted system or standard for collecting, documenting, and disseminating COVID-19 research outputs. There are bits and pieces across different domains in all of these areas, of course, and many of us are working very hard on trying to realize this at a broader kind of scientific level, but nothing in place for this particular pandemic and the requirement for it to happen quite quickly. So those are the main challenges. Okay, next slide, please. So what then are the objectives given these challenges? Well, the first one is to provide clearly and to clearly define detailed guidelines on data and software sharing, and data, software, and other kinds of research outputs that are necessary to understand the research that's being conducted. So that was a kind of clear main objective. And the purpose of that is to help stakeholders to follow best practice and to maximize efficiency. What are the ways that we can create guidelines, or what sort of guidelines can we put into researchers' hands so that these activities for sharing data can happen in an efficient kind of way. But then also from a slightly broader perspective, so that these guidelines could act as a blueprint for future emergencies, for future health emergencies, and to maximize the efficiency of the work. So there was the push for the immediate response to COVID-19, but then also to look at the broader picture. And RDA is going to pursue additional activities around data sharing with infectious diseases in its continuing work. Also to develop recommendations. So the way that we've used this terminology in the guidelines is that, or in the document, is that recommendations are for funders and policymakers to try to maximize timely quality data and software sharing. So these are kind of higher level things. What needs to be put in place at a structural level? Where should funding be directed, and that kind of thing. But then also to address the interests of researchers. So you're on the ground doing the research. What are the steps that you can take? And publishers and those that are operating data sharing infrastructures. Next slide. So this is very much a collaborative and cross-disciplinary effort. And those two things that I mentioned, guidelines and recommendations, really ended up structuring the document. And we did consider lots of different kinds of structures, but this is what we came up with, the editorial team came up with eventually in the end, to try to provide a kind of order to the document, even though the types of things that are discussed can be quite different from one of the groups to the next. So the guidelines are detailed practical advice that are aimed at researchers and data stewards, research software engineers, but also at public health officials and clinicians. And then the recommendations are higher level, often tend to be kinds of advice that we've been giving around research data management for some time, but that become even more crucial under this pandemic. So to give you a sense, as I mentioned before, there's 8 different groups. 4 of them are on particular research themes. So I won't go into too much detail, but I'll give a little bit of a sense of these research themes and what they contained. So with clinical medicine, the timely sharing of data from clinical research, including clinical trials, and we're all very familiar with this terminology after 5 months of this pandemic, is of the utmost importance. And many clinical studies are being performed under enormous time pressure, and sometimes study designs are not always fully optimal because of that pressure. That's the reality that we're all living under in different circumstances. So the designs may not be fully optimal, but at the same time, there's compelling reasons to share even preliminary results that may have implications for treatment. So this is back to that question around timeliness versus precision. At what point can you share things? Is there a danger in sharing data or outputs of scientific study too soon? There's certainly a danger in sharing it too late, because then it can't be built upon. So what do we do about this situation? So these recommendations and guidelines focus on some of the ways we can handle this. And the overall idea is that if trial outcomes are to be shared earlier than usual, than they normally would be through the scientific process, the research process, then they need to be accompanied by sufficient contextual information so we can understand these preliminary results. The data behind the study has to be available to allow verification by the wider scientific community and to understand the context of that study. So with open science, this is always the case, but even more crucial now. So that's a very light taste of what happens in the clinical section if you're taking a look at the document. Now on the omics side of things. So in order to understand the ways in which the SARS-CoV-2 the virus causes the COVID-19 disease, research to understand the biochemical processes at a cellular and subcellular level is critical, and this is going on all over the world. So this includes genomics, proteomics, and metabolomics in the case of our document. This is research on the functioning of the virus as well as its interaction with the host, and it encompasses these different areas. So many research groups across the world are working in these areas. And a major determinant of the rate of progress is the speed at which data is shared. So most of this data can be shared in existing repositories. There's quite a lot of developments around data sharing in omics. And there are widely shared common standards and for metadata and file types. So the guidelines in this case are here to help researchers to navigate through the options and to find the best and most efficient way to share the data. On to the epidemiology group. Understanding the epidemiology of COVID-19 is crucial to informing public health policies and to decreasing infection rates and minimizing deaths. We'll all be familiar with some of the elements around epidemiology because we're constantly looking into what we should do. Are we wearing face masks or not? How is it transmitted? Is it being transmitted to different populations? So epidemiological data and models are critical for decision-making regarding COVID-19 across all sectors of government. But there is no international standard or coordinated system for collecting and documenting COVID-19 epidemiological data, or really any epidemiological data. And of course, things are coming from all over the world, and they're relevant to any jurisdiction because a pandemic hits everywhere by definition. So the international aspect, the context to understand relevant factors in different regions are key. Pandemics don't know borders. So in some countries, such data and the models that are used to analyze them are not fully open or accessible. Or in every country, they're open in different kinds of ways. So the recommendations and guidelines support the development of an internationally harmonized specification to enable rapid reporting and integration of epidemiology and related data across domains and between jurisdictions. Of course, this is a massive effort, and it's not going to happen all at once, but what the guidelines do point out in this case is a pathway forward, which I think is a huge kind of innovation. And now to the social sciences. So social sciences approach things slightly differently than, I guess, the omics or the clinical side of things. They're collecting new information, but also reusing existing data sources, including online and social media, in research that can help inform policymakers about the social and economic impacts of COVID-19. As you can see, governments are trying to weigh this out all the time. Do we open schools and potentially put teachers and students at risk? Or, you know, do we not open them and worry about the economy? I mean, all of these questions are being weighed all the time. So social sciences also assess the success of the measures that are being implemented to mitigate the effects of the pandemic. And much of this kind of research involves observational methods that produce unique data, which can't necessarily be recreated in the future because of how specific the context is for that research. So it's important that data from the social sciences are collected, managed, and preserved in ways that allow them to be reused across all domains and to be leveraged over the longer term. This could be quite valuable as things go on. So this area looks at how researchers can ensure, for example, that consent procedures are in place for the reuse of that data, how to adopt licenses and agreements during the process of data acquisition that can enable downstream data sharing and preservation, among other kinds of things. Okay, so that's a taste of the four kind of key research areas that, that are in the document. And if we go to the next slide, I'll just give this is actually just a really quick look at a snapshot from the document itself. So this is from Omics, Guidelines for Host Genomics Data, and this is about suitable repositories to use. So if you take a look at this, you can see how precise and detailed are the guidelines. If you're, you know, if you're dealing with transcriptomics of human subjects, and I won't pretend I understand what that means, then you should take a look at the database of genotypes and phenotypes, for example. And there's quite a few pages of this level of detailed guidelines. Okay, next slide. Thanks. So those were the four research themes, but then, and these different themes here or groups came about at different times in the process as we kind of realized collectively as a working group the need for guidelines and recommendations in different areas that were not specific to a particular scientific research area. So one of those cross-cutting or overarching groups is on communities. And this is about kind of public and patient involvement throughout the data management lifecycle. You know, in this particular group, they were looking at contact tracing apps and that kind of thing. The Indigenous data guidelines, I won't go into it all actually because Mark is going to do a whole section on that later. And then research software was looking at what's particular to software itself. So we have data sharing guidelines, but research is conducted through software, and that software needs to be able to be accessed or used to understand some of those data outputs. And then also the last group that's on the slide here is about legal and ethical considerations. So this group was created to address specifically the legal and ethical kinds of questions that would arise, and they have a long section in the document as well. But they also went through the entire 143 pages several times to make sure that what different groups were saying were kind of in alignment, that we could be consistent with those guidelines. So if you click there, Robin, we'll do a little bit of a dive into the legal and ethical on the next slide. So this is just one example of what you can see on the legal and ethical portion of the document. These are guidelines around consent. How do you gain consent, and what sorts of things have to be considered? But there's also sections on, you know, guiding people to legal existing policy statements from different governments on legality of data sharing in these areas and ethics. There's a hierarchy of ethical obligations to help people navigate that landscape, guidelines on anonymization, and so on. Okay, next slide. And we're almost getting to the end here. That was a fair bit of information to throw at you. So these were put together, and as I said, the groups were working in sprints across a multitude of time zones, we should say, as well, from kind of West Coast North America through Europe to Australia. So you can imagine that not everybody had the best time for their Zoom calls. But as the guidelines from these different groups were being developed, it became clear that there were some key recommendations, often of a kind of overarching type, that were recurring in the different areas and that we thought should be pulled out and put at the beginning to say, these are some of the things that really everyone who's making policy or governments or funding research or conducting research should think about before we get into the details of the different areas. So these key recommendations, we kind of pulled this section together. This also went out through all of the open consultations and all of the rest, but this was a pretty heavy focus of the editorial team for a certain period of time. So it's a part that's kind of close to my heart. I won't go into all of them, but I'll name a few, and then you'll have the slides if you want to take a closer look. But the kinds of things we talked about here are around the challenges that come with this kind of pandemic in a broad sense and data sharing, and also the kinds of things that have to happen to enable data sharing and open science practices to grow and why they matter in this moment. So the first one there calls for the coordination of cross-jurisdictional efforts to foster global open science through policy and investment. That's a big ask, but it's really key. And this pandemic has made that, the truth of that statement very clear. Because many governments around the world are working on open science policies right now and building organizations. I know you have the NDRIO in Canada that's going to be looking at some of these issues. And of course, Mark Research Data Canada has been working on them for a long time. But there are efforts to connect across these geographical jurisdictions, but it's not always that easy. So that coordination is important. The publication, the early publication and release of data and software, which could be reused quite quickly, should be incentivized. So it's not just a matter of saying, put your data out there. You have to make that something that is appealing to researchers who may, who have limited time and may want to move on to the next study first. But to share the data itself that underlies the research is really important. So there need to be incentives around that. Investment in infrastructure. We can't do this kind of data sharing work without adequate infrastructure that supports it. Fair data was another very key thing. In fact, all of the groups, I think all of the groups, it's fair to say, at some point mentioned fair data, and some of them went into more detail on that. So this is actually quite encouraging, because that means that the fair data principles are really globally providing a kind of cohesive pathway forward for data sharing. There's a lot more on here. Use of trustworthy data repositories. I can't say that I don't agree with that, seeing that's what I run here in Ireland. But also, use of common and domain-specific metadata standards, persistent identifiers. These are more granular things that come with using TDRs, in fact. Okay, so I'm going to leave that there. I think I've mostly touched on the rest of those before. And the last thing that I want to say is that the different images you were seeing were pulled from this really beautiful spinning or just spinning infographic that was created by Canary and RDC. So thank you for that. It made the slides much prettier than if I had just put my regular bullet points on them. I'm going to hand it back over to Mark now. And thank you so much for your attention to this, or for joining this webinar.
Great, thanks, Natalie. And Natalie will come back, I'm assuming, once we're done, because I'm assuming people have other questions. I did respond to a couple of questions from one of our colleagues on the webinar in the Q&A panel, so you can see those in the answered tab. But I just wanted to kind of address them in a general context. One of the approaches that the working group took, as you can imagine, and as this slide says, there were 600 members, a number of them new to RDA, who joined the initiative when it was announced. Probably about 165, somewhere shy of 200 people were pretty active. in those 8 groups that Natalie mentioned. So it was a pretty substantial effort. And you can also imagine that one of the substantial efforts was taking the writing sprints and the outputs that these 8 groups created and pulling them together into a single document with a common language and a common structure, and not being repetitive in certain areas. So there was a lot of attention paid to trying to produce a document that was accessible. I mean, it is in the 100+ page range, so it is substantial. But in doing that, we deliberately took a slightly higher level focus on the guidelines and recommendations. So some of the questions that were asked related to, you know, preserving privacy while allowing data to be accessed and by people while protecting privacy. There's not a specific detail in the guidelines related to how you do that. They are recognized that those are important things to do. But having said that, some of the more detailed, or some of the thematic sections in particular, have more detailed guidelines that are linked to from the overall guidelines and recommendations that were published at the end of June. And there are additional documents, which I'll discuss shortly, that are being written now for submission to journal articles and producing additional outputs. So what I would say at this point is that the guidelines and recommendations represent the consensus of the community in those somewhere between 165 and 600 participants consensus over 2 months. And there will be additional details to come. So any of the kinds of things that people think are important that should be reflected in subsequent documentation would be much appreciated. So as I mentioned, and as Natalie mentioned at the outset of her remarks, this initiative was started in late March and essentially took off in earnest in April and May, producing the final version after 5 public releases between April and June, with the final version coming out on June 30th. So that effort required a lot of coordination. So as Natalie mentioned, there were a number of co-chairs, and she was one. I was another. There were actually 7 co-chairs. We brought Natalie on after the initial 6 co-chairs so that she could take on the role of that editorial team co-chair. So Natalie actually represents the 7th, and then we were joined on each of our weekly meetings by members from the RDA Secretariat who did a lot of the heavy lifting in terms of crafting the documents and the different releases and that very complex process of making sure all of those things are done properly. So it was a pretty substantial effort, and as the bullet suggests, there were experts from the different fields, there were generalists, there were folks from the researchers in all the disciplines, there were generalists, there were repository managers. So there was the broad strokes representation of the community. So despite that challenge, we were able to produce what I think is a pretty substantial document, and I suspect it will be the first of not so much maybe not necessarily another fulsome version of the document, but there will be additional outputs coming. Some of them are already in the works. And the other thing I should point out on the right-hand side, which lists RDA's guiding principles, the other both challenge and opportunity that is presented with this kind of work is that RDA's guiding principles include those very important elements of openness, consensus, balance, harmonization, community-driven. And those in particular, I think, are critical to RDA's success. But as anybody on this call who has participated in these kinds of events knows, that kind of approach can also lead to time constraints and extensions and challenges. But I think kudos to the RDA community for pulling this off in the timeline that we did have. Next slide. So I did want to focus in, Natalie focused in on a couple of the, one of the thematic areas and one of the overarching themes. I also wanted to kind of cameo the effort that was undertaken to produce some recommendations around Indigenous data. And I wanted to mention this one in particular because this group was pulled together towards the end of the, i.e. in the beginning of June. Was a group of dedicated folks who have been involved in the RDA community for some time. And through that RDA community, a year or so ago, produced or created an organization called the Global Indigenous Data Alliance, or GIDA. And that group has created something called the CARE Principles, which is a very important concept, not just in terms of working with Indigenous data, but I think is something that everybody in the research ecosystem should read. And there's value for any researcher or organization that supports researchers. And CARE, the CARE principles, CARE stands for collective benefit, authority to control, responsibility, and ethics. And there are similar kinds of guidelines that various Indigenous communities around the world have created, including the OCAP principles here in Canada, which are an effort from the First Nations community in Canada. So that group came together very late at the towards the end of the effort. They agreed to pull together some recommendations, and because they had worked together on the CARE principles, I think they were able to pull together a very substantial output in the time that they had. One of the overarching, you can see in the table at the bottom, some of the kind of core threads or principles that emerge from those guidelines, but a key one is the collective benefit, and that data ecosystems shall be designed and function in ways that enable Indigenous peoples to derive benefit from the data. And clearly, I think that that's a principle, as I said, that any researcher or research subject would benefit from if the research community were to embrace that and consider that in all cases of research. So I wanted to thank the group. This is one of the groups that went without a moderator. There was about 9 colleagues who simply gathered together over probably half a dozen or more sprints over the course of 2 to 3 weeks. So kudos to that group, and their names are in the final document. Next slide. Some of the other outputs that are coming, of course, with the release of the guidelines at the end of June, we also released a Zotero Library. For those that are not familiar with Zotero, it's a bibliographic data management tool that allows you to easily harvest and maintain a list of research articles or reports. So we use the Zotero Library, which is now public. So anybody can see I'm not even sure how many they were, Natalie might know, or Robin, a huge number of citations that were listed in the guidelines. So the full details of those are available through Zotero, which of course means you can also get to the final output, such as a PDF, through that Zotero library, as you can through the guidelines themselves. Natalie mentioned the infographic, which was prepared to kind of provide a higher level pathway into the guidelines, which was again created by the Canary team. Next slide. Another substantial effort that's underway is using a tool called the Data Stewardship Wizard, which comes out of some efforts in the EU. And essentially what the Data Stewardship Wizard will do is allow initially some of the participants from the original working group to take the textual elements of the guidelines and atomize them, as I say, or boil them down into specific individual recommendations and bits of text that answer specific questions, and then create a tool that anybody could log into and copy or modify to produce a custom version of the recommendations. So you could go into this Data Stewardship Wizard with the goal of creating a custom output specifically addressing the omics, or even a subcategory of that, such as proteomics, and produce a smaller version of the guidelines and recommendations that essentially focuses on that data sharing and proteomics. And the nice thing about it is it would not only allow you to kind of pick from those important higher level, non-thematic specific components, but also include those thematic components into a single output. And then those can be created and shared via the tool or produced output as PDF. The other important thing that we're hoping people will take advantage of with the Data Stewardship Wizard is creating, if you will, national versions of the guidelines and recommendations. So for example, one of the challenges we had in the legal and ethical section was just the simple fact that the terminology around ethics, compliance and the like varied from jurisdiction to jurisdiction. There were some very strict and specific legal contexts in which researchers in different regions or nations are subject to. So the Data Stewardship Wizard, so we weren't able to go there into that level of detail. So we had to agree to a kind of a common language and a high level summary. But what we're hoping the Data Stewardship Wizard will do is allow people to go in and add additional guidelines and recommendations that aren't in these, but reflect more of that national, for example, legal and ethical kind of context. Or maybe there's a specific, in the case of Canada, Canadian data repository that is recommended for a particular type of data to be deposited in. And then maybe that repository then takes care of federating it out to international repositories. So we're still working on this, and we're hoping to release a version of it in September. And again, it will be the full set of guidelines, but atomized down into a specific set of elements that respond to specific data sharing interests or requirements. And I know in the Canadian context, we are hoping to work with colleagues from the Portage Network and other agencies such as funding agencies to look at how we can use this tool to create a Canadian lens, if you will, on the RDA data sharing guidelines. Next slide. So there's, as I mentioned, or kind of implied previously, there are a number of journal articles that are emerging from this effort. One of the articles is simply on the effort itself, what it took to produce the guidelines in such a short timeline. Some of the articles will zoom in on the guidelines from a specific thematic context. And some of them will talk about the impact and how the guidelines can best be used in the research ecosystem. There are a number of groups, including the COVID-19 working group itself, that will emerge from this effort in the upcoming RDA Plenary 16, which was due to happen in Costa Rica, but of course with the travel restrictions will be virtual, but is still being managed and co-hosted by our colleagues in Costa Rica and the US and RDC in Canada. So there's a number of submissions that have been made, including Birds of a Feather session on infectious disease, which we hope will provide a kind of an umbrella conversational context for a lot of these types of efforts as they continue to gain steam in the RDA and other collaborative organizations within the broader international ecosystem. So I would certainly recommend looking into attending the virtual RDA Plenary 16. It's happening in November and the dates have just escaped me. But you can easily find them on the RDA website under the plenaries menu item. And we're also seeing a lot of stakeholder support, adoption, endorsements, implementations of the guidelines, lots of positive comments from policymakers, funders, and publishers. Also on a kind of a personal note, one of my other hats I wear is coordinating the Research Data Management Funding Program under Canary. And one of the examples we saw, some of the colleagues that participated in the omics working group are from a project called iReceptor, which is a data repository for immunogenomics. And given the importance of the immune system and the components that one does research in immunogenomics, that data repository is becoming very important. And I think they already have 8 comprehensive studies on COVID-19 in terms of immunogenomics and over 200 million data sets from the COVID-19 context. So that's another example of the kind of the benefit that the ecosystem gains, not just in terms of members of that very specific research community participating in the RDA effort, but then that community turning around and retooling themselves as RDA did to take a platform that was not thinking about COVID-19, obviously, when it was created a number of years ago, but has since been retooled to respond to the data sharing requirement in a specific area like immunogenomics. So there's so many ways that these different efforts work together. It's quite something to see. Next slide. The best place to kind of see the fulsome representation of what the RDA community produced is through this URL, or you can Google value of RDA for COVID-19. And I highlight this page just because the final kind of output page is a little somewhat confusing in terms of accessing all of the outputs. And here you can access things like the Zotero Library and the infographic. You'll be able to get to the data stewardship wizard from this page. So this is a much better page for accessing all of the information related to the RDA efforts. And it includes a number of those joint statements, and we'll list the journal articles that are specific about the guidelines and those kinds of things. So this is an important page to bookmark if you're interested in what's happening after the initial release. And I see somebody has put that link in the chat, and also reminded me that the dates for the Costa Rica virtual RDA plenary are November 9th to 12th. Thanks, Natalie. Next slide. So that's it. Here's some additional contact points. I would encourage those of you that aren't involved in RDA to consider it. And you may want to consider that with the getting involved in the upcoming Plenary 16. The RDA community is a very responsive one. There is over 10,000 members, but despite that size, it's a very tight group and works together, as you can imagine from the COVID-19 guidelines output, works very well together. And also some contact info for myself and Natalie. And I believe that's it. I'm going to respond to one of the other questions that I asked that wasn't responded to. And the question is, any notion to create a Canada-wide research Hadoop file system tools with authentication and authorization being built in? I certainly do know of a number of Hadoop-based tools accessible to researchers in regional and institutional contexts. And I would suggest to the individual asking the question that probably that will be responded to in the context of NDRIO, which Natalie mentioned. NDRIO stands for the New Digital Research Infrastructure Organization. So it's just getting underway. They're in the process of selecting a CEO. And one of the things that will happen with NDRIO is that it will take on responsibility for research software, research data management, including what I do at Canary with RDC and research data management. But it will also pull in what we now know as Compute Canada. So all of those elements and the expertise that's represented in those existing bodies and agencies will come together under NDRIO, and I suspect what you will see is those Compute Canada resources being put towards this kind of effort. In addition to that, I'm not sure that it's going to be Hadoop based, but you also have projects like the Panther project in Ontario, which has been renamed something else. I know it as, continue to know it as Panther because that's what was its initial name. So I think there will be a number of projects like that that will respond to this opportunity. And I'm not sure where the person who asked the questions from, but I'm pretty sure that the Canadian Research Data, the SPORE network node, SPORE is the patient-oriented research. I forget what the S stands for. SPORE is a Canadian Institutes for Health Research funded initiative across Canada, and the Halifax node out of Dalhousie, I'm fairly sure, uses a Hadoop-based platform for the analysis and review of research data. So that may be something that you might want to look into. And I see one of our colleagues has also put in the link to formerly, what was formerly known as Panther, now known as the Ontario Health Data Platform. And I also see that another one of our colleagues has put in the link for iReceptor, which I mentioned, which is that platform that's working on immunogenomics data from the B cell and T cell receptors. That's being seen a huge jump in use to access their COVID-19 data. So I'm going to indicate that those two questions were answered live. Are there any other questions that people have? Or Natalie, do you have any additional comments on any of the questions? Or
no, I think I feel like I talked a lot around all those guidelines. Yeah, nothing else to add at this point, other than I mean, I would just reiterate what Mark said about potentially getting involved in RDA. We at DRI got involved in it kind of in its early inception, and hosted one of the plenaries in Dublin, and didn't know much about what was happening because it was all quite new. And it's grown so significantly since then. And it provides such a great platform, and it's been really fascinating to watch it developed and how it can kind of encompass new things that happen over time. So one of the first groups was around wheat data sharing. And then, did you know, we went to Japan, and then there was a group on rice data sharing. So it's been a really interesting organization to kind of roll up your sleeves and get these things done. And if there's something you're interested in, like even some of the questions that came in through the Q&A, something you think would be worth developing, it's a great mechanism for that. Yeah.
Yeah, and I know that question, one of the questions I responded to with a text answer was related to providing a discovery function that allows discovery of data while respecting privacy. And you know, the details that are embedded in that question are, how do you prevent identification of individuals through linked data, and all of the complexities that come when you start to make this kind of data accessible. So there was a substantial discussion of that. I don't remember, Natalie, I don't know if you would, if the omics or epidemiology or clinical subgroup documents, which were substantially larger than the final section that made it into the guidelines, would have any more detail. But it would be worth clicking on those links in the final document to the subgroup efforts to follow up, or, as Natalie says, get involved in RDA, and I'm sure there's a group or more, 2 or 3 groups that would be addressing that particular issue. Robin, did you have anything to add? I forgot to mention that one of the efforts in the guidelines document was a substantial glossary and acronym list that Robin pulled together near the end of the session, or near the end of the effort. So thanks to Robin for that contribution. Did you have anything you wanted to add, Robin?
It's like both of you have been saying, it's quite it's such an impressive effort, particularly for this COVID-19 working group. And the compiling the glossary was a task about a month into my new position, so it was a bit of a trial by fire, but it was such an enjoyable and really exciting experience. So yeah, it's really nice to see everything coming to fruition now.
Yeah, it was a good project to get involved with as a fresh graduate from
it's a great glossary. I encourage people to take a look at it, whether or not you're going to be, you know, adopting these guidelines in this domain. It's very good.
So if there's no other questions, I know that there are additional webinars coming from our international colleagues. Canada, Research Data Canada is doing a follow-up webinar, and Robin, you might need to refresh my memory on the date. If we set the date, there's one in, we may change the date, I believe.
Yes, it's tentatively scheduled for mid-September, probably September 16th, if all goes well.
And that is a webinar that will dive into the details of the data stewardship wizard and provide more information on some of the additional outputs that will be coming out in the next month. And that one will be co-presented with Rob Hooft, who was the data stewardship wizard brain, and also one of the moderators, co-moderators for the Omics group, and a very active participant in the effort. So look forward to working with Rob on that webinar session. All right, I don't see any other questions, and a few bonjours and thanks in the chat. So many thanks for colleagues for joining the call, the webinar today, and thanks to Natalie for joining us from Ireland. I wish you were able to do it from Canada, but maybe next year.
I wish I could.
And
Canada sometime. Let's see.
Someday.
Yeah.
And thanks, Robin, for organizing, and thanks everybody for attending. You'll receive a message when the webinar is available. Webinar recording is available. All right. Thank you.
Bye-bye. Thanks, Mark. Thanks, Robin.
Thanks, Natalie.